Hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for over 37 years. And I spend time looking for articles or other resources that give us more information about this baffling and frustrating disease that we're dealing with. There was a study that was done fairly recently in Germany that looked at drug interactions and specifically how MS therapies might be prone to interactions with other medications or over-the-counter supplements, vitamins, whatever. And I thought we could just take a quick look at that today. Well, here's the article from MD Edge. Risk of drug interactions is on the rise as MS drugs evolve. It's a pretty short article, so I think I'm just going to go ahead and read it and maybe have a comment here and there as we go through. And as they say here in the introduction, how often do patients with multiple sclerosis end up taking drugs that could dangerously interact with other medications they're taking? A new German study provides a disturbing hint. A pharmacist who spoke at the annual meeting of the Consortium of Multiple Sclerosis Centers told colleagues, out of 627 patients who took an average of 5.3 drugs each, about 1 in 25 faced a potentially severe interaction, and nearly 2/3 had at least one potentially risky interaction. Janelle H. Montgomery of Duke University Hospital notes, interactions don't just put patients at risk of adverse effects and hospitalizations, they can also lead to secondary comorbidities and therapeutic failures. So having multiple sclerosis and taking a medication that puts you at risk for something like high blood pressure or some kind of organ disease, you want to be sure that you don't go down that path. I thought this was pretty interesting. Newer versus older drugs. Drug interactions in MS have become more common as disease-modifying therapies have evolved, she said. Some older drugs, such as glatiramer acetate, which is Copaxone, beta interferons, and fumarates, have low interaction profiles. But newer drugs have more drug interactions caused in part by their side effect profiles, oral routes of administration, and immunosuppressive instead of immunomodulatory effects. Teriflunomide, for example, interacts with rosuvastatin and warfarin. S1P modulators are especially complex on the interaction front, Dr. Montgomery said. Cardiology consults are recommended for patients taking siponimod, ozanimod, and ponesimod, and there are a number of potential interactions between these drugs and other medications. In regard to other MS drugs, other medications can disrupt the metabolism of cladribine, she said, and the manufacturer recommends separating any other oral drug doses by 3 hours. Even MS-related drugs can interact. Carbamazepine, which is Tegretol, used to treat MS-related neuropathic pain, interacts with drugs such as siponimod. And I'll also tell you that foods can even interact with drugs. Carbamazepine in particular, I happen to know because I was taking Tegretol for trigeminal neuralgia for some time. And the pharmacist told me, don't eat grapefruit when you're taking this because the grapefruit can blunt the effectiveness of the carbamazepine. So it's not just drugs, but even certain foods can interact with your medications. And then here they say, who is most at risk? Dr. Montgomery highlighted the kinds of patients who were most at risk of polypharmacy per the 2022 German study: older people, those with lower education levels, and those with more disability. And she pointed out that 77% of all drug interactions were between prescription drugs. Another 19% were between prescription drugs and over-the-counter medications, and 4% were between over-the-counter drugs. She also emphasized the importance of asking about everything that a patient is taking, including herbal supplements, as nearly 60% of people aged 20 and over take them, and about 75% of those over 60. a quarter of people over age 60 take at least 4 supplements. And I would count myself in that category because I do. And then this last paragraph, it says, Dr. Montgomery also offered several tips. Periodically ask patients to bring in medication bottles or pill boxes, encourage annual checkups with primary physicians, and use drug resources such as facts and comparisons, lexicon, clinical pharmacology, micromedex, and natural medicines. And I'll look those sites up and put some links in the description for you on those. So I found the actual paper that's being referenced in the article that I just read to you, and we're not going to go through this, but I just wanted to read you the abstract. It's called Prevalence and Severity of Potential Drug-Drug Interactions in Patients with Multiple Sclerosis with and Without Polypharmacy. And as we said before, this is a study out of Germany. Here's their abstract. I'm just going to read the last sentence or so because I think this is going to help put this in context a little bit for you. Of all the patients in the study, 63.8% had at least one potential drug-drug interaction, with a mean of 4.6 potential drug-drug interactions per patient. And okay, I want to focus there on that word potential. Potential does not mean actual, right? It means there was a possibility of an interaction. So that to me was a little bit confusing. I suppose if I read the whole paper, I might find out what that's really saying, but it doesn't sound quite as dire if we're only talking about potential. It's something to be aware of, certainly, but it's not like saying that these were actual drug-drug interactions. And then we go on, it says less than 4% of all of these potential drug-drug interactions were moderately severe or severe. See, so once again, we're kind of stepping down the scare factor here. And it's always good to look into these things to make sure you don't panic when you hear some kind of headline like, MS drugs interact and cause terrible things. That's not what they're saying. Medication schedules should be checked for inappropriate medication and for possible interacting drugs to prevent potential drug-drug interactions. Physicians as well as pharmacists should be more sensitive toward the relevance of potential drug-drug interactions and know how they can be detected and avoided. So what do we take away from all of this? I just put together some reminders for us, and I think that's really the bottom line, is that this is not really a warning as much as it is just some reminders. The majority of people are taking at least one over-the-counter supplement or prescription medication, and the number increases with age, so the older people get, the more of these they are on, which makes sense. Even over-the-counter supplements, though, can interact with prescription drugs. So if you're taking vitamin D, for example, or if you're taking lipoic acid, you never know. There could still be some interaction. It's worth paying attention to. Newer multiple sclerosis therapies are more prone to such interactions. Because of their mechanism of action, the newer ones are more likely to cause these interactions. Copaxone, I know, is one of the safer medications all around, but some of these more sophisticated ones do things to your immune system that have a bigger impact, and so therefore they're more likely to be risky for drug interactions. And then for most interactions, though, they don't have significant health consequences, but some do. So tell your MS Health team about all the over-the-counter or prescription pharmaceuticals that you happen to be taking, including the dosages. I've had doctors tell me that I had to reduce dosages on one or two things because of other problems that I had, and that brings up the last point. Tell your MS Health team about other health issues that might increase risk. So, for example, I am on amantadine, but I am only on half the normal dose because I only have one kidney. And the doctor just wanted to be absolutely sure we didn't let the amount of amantadine build up in my system if it wasn't being cleared by my kidneys quickly enough. So you see, even though my neurologist would not necessarily have known what was going on from my oncologist. It's just good for me to be the one that lets them know about potential problems. Well, I hope that that was useful for you. I hope that those reminders were timely. And maybe there are some questions you can ask your doctor that you might not have thought of asking. And certainly every time another doctor, maybe your primary care doctor or some other specialist that you go to, as they want to prescribe medications for you, you might want to check ahead of time, perhaps, as to whether that's going to interact with your MS therapies. Let me know in the comments if any of this information was helpful for you, or if you know of drug interactions, or if you've been told of specific ones, so that we can all learn and benefit from that knowledge. Well, that's all I have, so take really good care of yourself, and I will see you again in my next video.